Hello everyone, good evening to another Instagram live where today I'll be talking about the scope of nuclear medicine as a branch in India. Hi, good evening everyone. If you can hear me, just thumbs up please. Hi everyone, good evening. Good evening. So, welcome to another live session, and today I'll be discussing the scope of nuclear medicine as a PG branch in India. And I'm honored to be joined by Dr. Charu Jora, who I work very closely with. You know that cancer treatment is a team game, and Dr. Charu is the one who reports most of my PET scans. So, welcome, Dr. Charu. Welcome to this live session. And
Thank you, Dr. Rohan. Thank you so much.
thank you for taking out time and discussing this very important issue because not a lot of students know about nuclear medicine and they
Yeah,
always have their doubts. So why
right.
don't you begin with a brief introduction about yourself and then we'll dive into the questions which the students have posted.
Yeah, so good evening, everybody. I'm Dr. Charu Jora. I have been practicing nuclear medicine for 12 years now, and I did my graduation from Delhi, from Army Hospital, and I did my secondary DNB from Gangaram. So even I didn't know about nuclear medicine at the time when I jumped into this field, but I have been loving it so far. So nuclear medicine is why is it called nuclear? Is because we use radioactive materials in that, and we use. So how is it different from radiology? Like in radiology, we the x-rays or the photons, the radiation that is being used, it is projected from outside, it crosses your body, and then it is detected by detectors placed behind your body. So this is, in a layman term, this is how radiology works, right? So in nuclear medicine, we give the radioactive material which will emit the radiation, we inject it inside the patient's body. So it's a very small dose it is given, and its half life is also very small. So it disintegrates completely in different radio tracers have different half life. So somewhere between 30 minutes, 60 minutes to 1.5 hours, 2 hours. So this is how it goes. So in that, the patient itself is the source of radiation, and that radiation is captured by cameras or detectors, and we get the image. So that's why it is called nuclear medicine.
So
And
ma'am,
yeah.
a common query which students have is that is it only diagnostic or there are therapeutic avenues to nuclear medicine as well? And
Yeah.
what would be the bread and butter for a nuclear medicine doctor? And what are the other avenues which are there which they can look upon as well?
Right. So nuclear medicine has both diagnostic and therapeutic aspects to it. So if we talk about diagnostics, we have gamma camera imaging, which images all the body parts right from head to toe. So there is a dedicated brain imaging, thyroid, salivary glands, heart, lung scintigraphy, liver, spleen, kidneys, and endless gallbladder. So stomach, and then besides the gamma camera, we have the PET-CT scan. I'm sure everyone must have heard about it. So PET-CT scan, in PET-CT scan, we do the imaging of cancers, as well as we use it for non-malignant conditions as well. These are the diagnostic aspects of nuclear medicine. In therapy, so iodine therapy, some of you must have heard about it. So
Yeah.
iodine therapy is used for thyroid malignancies, as well as for Graves' disease, hyperthyroidism. And besides iodine therapy, so iodine therapy has been there for a long, long time now. But in nuclear medicine, therapeutics is one aspect that is ever evolving. So right now we call it as theranostics. So
Yes.
theranostics means in nuclear medicine, what we do is we use one tracer or one drug to image a particular type of cancer. We see that where in the body the cancer is placed, where all has it metastasized, and then we attach a cancer killing drug to that particular tracer, and then so that tracer takes that cancer killing drug only to the sites of tumor and kills the tumor. So this is known as theranostics. That means we image the therapy before giving
Right.
the therapy. Yeah, so we
Yeah. So
image the kind of result that we will get.
So that's a very
Yeah.
important term which is coming up in nuclear medicine, that is theranostics. And as ma'am
Yeah.
is saying that it's a very smart way to kill cancer. So
Yeah.
that is the main therapeutic element of nuclear medicine, in addition to treatment for hyperthyroidism and post-thyroid cancers as
Yeah,
well.
so I can see that some people are asking about the good DNB hospitals for nuclear medicine. So there are lots and lots of hospitals all across India. It depends like the kind of seat that you get and what is your place preference. So there are a lot of hospitals. You'll have to, you'll have to ask me which particular area are
We,
you looking
we
for.
come to that, ma'am. I've made a list of that, so
Okay.
we'll talk about
Yeah,
that topic
sure.
later.
Yeah.
So, as ma'am has mentioned, nuclear medicine is an evolving branch. It's a relatively new branch which has both diagnostic and therapeutic aspects to it. She's spoken about both the diagnostic and the therapeutic aspects. So, ma'am, what is the scope in India? And if I would just add another follow-on question to that, what would be your take on it, say 2, 3, 4 years down the line, the scope in tier 2 and tier 3 cities? Because some of the students have been messaging me saying that it is getting saturated in major metropolitan cities.
Yeah. So I don't know if you all are aware, there are around 19 cyclotrons, 17 cyclotrons in India right now. So cyclotron is a setup wherein we produce FDG, which is used for PET-CT scan. So again, for PET-CT scan, we have n number of tracers, but FDG is most commonly used. It is widely available. So why I told you the cyclotron number is because so that you can have a fair idea. So more is the number of cyclotrons, more are the number of setups that come up. So and these 17 cyclotrons are spread out across the length and breadth of India. They're everywhere, north, south, east, west. And that's why in tier 2 and tier 3 cities, the scope of nuclear medicine is now increasing. Initially, when this saturation thing, you're right, it is happening in metros now because there are a lot of centers have mushroomed up. Every hospital or a small setup that is doing some cancer related work wants nuclear medicine, because without PET-CT, it is very PET-CT physicians or nuclear medicine physicians are the eyes of the oncologists. So they can see
Right.
the disease before operating, they can see the disease before giving chemotherapy. So how PET-CT helps? So you should also know that, like, how do we help? So we help in the initial staging of the disease. Then once the staging, as in before surgery or before starting chemotherapy, then once the chemotherapy has started, the doctor wants to know that after 2 cycles, is the tumor responding to the medicines that I'm giving, or is it not responding? So again, we come into the picture. If the tumor is responding, the doctor will continue with the same therapy. If not, he will change it. And then it's end of treatment response. Like when the entire treatment has been given, has the disease responded completely or not? Or do we need to do some consolidative therapy or not? Or we need to keep the patient on maintenance therapy. And then there is, like, once all the treatment has been done, for follow-up, whether the disease is coming back again and we can pick it up and target it before it creates some havoc inside. And then there is the surveillance, routine surveillance, that is done like once every year. So in tier 2, tier 3 cities, because of the coming up of cyclotrons, a lot of cyclotrons coming up, you have a lot of scope there, and more scope there salary wise and competition wise also, because there is not much competition over there and there is a huge demand.
So as ma'am has mentioned, yes, there is some bit of saturation in metropolitan cities, but I have mentioned this time and again that oncology is one of the branches for the future as well. With the ever increasing number of cancer cases, the demand for a holistic cancer approach, which includes nuclear medicine, will keep on increasing. And there are more tier 2 and tier 3 cities where nuclear medicine options are opening up. And as ma'am mentioned, that if you go and settle in a tier 2, tier 3 cities, growth opportunities are also much more, because you'll probably be joining directly as the head of the unit. So that brings me to the next question. What are the growth opportunities like in government setups versus private setups? And if you can broadly talk about the salaries or the broad figures, because that is another thing which goes into the mind of the student when they're picking up a branch.
Right. So see, in nuclear medicine is one of those rare fields in which when you rise from SR to consultant level, that rise is pretty quick. You don't have to wait for a long time. It's pretty quick, as Dr. Rohan mentioned. because there is a dearth of doctors. You don't see a lot of nuclear medicine physicians around you, because the seats are also limited, and it's a relatively new branch. So that is how it is. So, and now in government setup, of course, there will always be a gap between the government setup salaries and the private setup salaries. That will always be there. But it's always wise to do, once you are done with your qualification, it's always wise
More
to
in the
do
private
SRship.
setup? It's
Yeah.
more in the setup?
Yeah, it's more. Definitely more in the private setup. Definitely.
So,
So,
approximate idea, ma'am, these days an SR in Delhi is earning close to 1 lakh rupees a month. So when they
right.
step after doing their SRship in nuclear medicine, if they come in as a consultant, will it be in the range of 2 to 3
So I'll
lakh
tell
rupees?
you. So how it is. So once you're done your SRship, if you're going in a private setup as in private hospital setup, so wherein there is a team of 4-5 doctors in the nuclear medicine department, and you are joining as attending consultant or associate consultant. So there, yeah. So there, you may get somewhere between 1.75 starting.
Okay.
1.5,
Right.
1.75. But if you join a diagnostic center, wherein you will be the only person who will be doing everything, so therein you can catch anything between from 2, 2.5, 3 also, depending on your work ex, depending on the
Which
institute that you're coming from.
which is quite good considering that
Yeah.
you will get immediately after your SRship. And then
Yeah.
there's a steady growth over the years then.
Yes. That is
Okay.
there. That is
Perfect.
there.
And
Yeah.
obvious questions which students have, are there any emergencies involved, or the work-life balance and the duty hours are pretty set in nuclear
No.
medicine?
Yeah, so there are no night duties, there are no Sundays, there are no emergencies. It's all pretty set. I mean, it's like a 9 to 5 job, and it's a very good field if you want to maintain a work-life balance. My intent of jumping into nuclear medicine was this only. This was the main reason, because I wanted a field wherein I could balance work and life both.
Perfect. So good work-life balance, no emergencies, whether you're in the government setup or in the private setup, you have a 9 to 5 kind of a job. And it's a stable growth option where, every
Yeah,
year there is bound to be some growth.
yeah.
Now, ma'am, another question which students have is that can one have their own private setup as well, or is
Yeah.
it cost intensive and requires a huge investment?
So it does require an investment. I'll tell you, if you want to, nowadays, anyone who wants to set up a nuclear medicine setup, they usually go in for a PET-CT scanner
Right.
only, plus with or without radiology services. And if you want to set up a PET-CT scanner, then you will need somewhere between around 6 to 7 CRs.
Okay. So huge investment required if one wants to have their own private setup. So usually doctors who are graduating will either remain in corporate setups or private labs or in government setups.
Yeah.
Okay. So ma'am, another question which has come up quite frequently is what is the difference between nuclear medicine and radiotherapy? Some students are confused between the two. So can you elaborate on that, and then I'll add to that?
Yeah, sure. So radiotherapy is you are giving therapy using radiations, we can say, right? And again, those radiations are not injected inside the body of the patient. In nuclear medicine also we do therapy, but in nuclear medicine the therapy is done by injecting or ingesting the radioactive material. So that is the difference between in radiotherapy and in radiotherapy there is no imaging. There is
Right.
nothing diagnosis related. In nuclear medicine, it's both diagnosis and the therapeutics.
So
So the layman language difference, yeah.
another thing which I remember, when I was doing my oncology training, whenever I used to visit the nuclear medicine department, that the nuclear medicine team used to work very closely with radiology as well. So how
Mm-hmm.
much of the training involves learning radiological aspects like CT scan as well during the PG and training part?
So yes, CT is a very important curriculum of nuclear medicine learning, and every good nuclear medicine setup does send its residents to the CT department, to the radiology department. There is an attached posting happening. It happens everywhere, and you also keep on learning when you're doing the work, when you watch your seniors. So basically we want to learn CT because we are reporting PET-CT. And when we report PET-CT, the CT aspect is a complete diagnostic CT that a radiologist reports. So the reporting is as per the radiology terms and regulations. So that's why we must be aware of all the CT terminologies and how a CT reporting has to be done.
So good anatomical knowledge and
Yeah.
basic radiology, especially CT scan, because that's the bread and butter. You're reporting PET-CT
Right.
is a
Right.
while you're doing training. Do you have to study a lot of physics as well? That was one of the questions the students had posted.
Yeah. So obviously people who have had maths or who love maths have an edge over here, because physics, you need to study physics. You need to study physics for clearing your exams, but otherwise not much. Like when you're like for your clinical work, you don't need much of that. But for clearing exams, yes, you need to study physics.
So a lot of girls have posed this question that, because you're dealing with radiation and with radioactive compounds, are there any health hazards? How do you take care of them? And in terms of girls starting a family, are there any issues with that as well?
Yeah, so I have had both my kids while I was working in the department till the ninth
Yeah.
day of the pregnancy. So so there is no problem as such. It's just that number one, I'll take the first question first. That there is never ever have I come across any health worker, be it a doctor or a paramedical staff, or anyone who injects the patients. Like never have I seen that their readings have gone beyond the limit or even have come anywhere near the limit recommended by Atomic Energy Regulatory Board. So the kind of work that we do and the way the work has been designed, the radiation exposure is never near the danger level or critical level, never. And
Okay.
secondly, once we have a female staff who is expecting, so she is then transferred to an area that doesn't involve radiation. That is the reporting room, or like I'm talking from doctor point of view. So you just need to do the reports. You don't interact with the injected patients. You interact with the relatives. You see the scans. You don't go near the hot lab. So this is how it is being done. So that can be managed. That's not a
So
problem at all.
with proper precautions, it's a very safe branch and no long-term.
Yeah, absolutely.
There.
Yeah.
What about patient interaction? Students are asking if you're routinely interacting with patients, or it's more of a radiological kind of work where you just report the PET-CT, which is when you get
Yeah.
the film.
So that's the beauty of nuclear medicine. If you work in a dedicated nuclear medicine setup that has both the gamma camera and the PET-CT setup, so there you have proper thyroid OPDs, you have patients following up with you. And in therapeutics, I couldn't touch everything. So in therapeutics, there are therapies for thyroid cancer, for neuroendocrine tumors, in which you do PRRT therapies. There are bone pain palliation therapies, radiosynovectomies, then liver tumor ablation therapies. So all these patients follow up back to you only. So you and the endocrinologist or the medical oncologist. So this is how it is. So you have, yes, in nuclear medicine, you have OPDs, you have patient interaction. And when you are doing stress thallium tests that you do for heart and all the other gamma imaging tests, cardiac scans. So all throughout patient interaction is there. So it's not like you're just sitting in a room and you are reporting the scan and you're not seeing the patient or talking to the patient.
Perfect. Another question which keeps on coming up again and again is foreign scope in scope abroad in UK, USA. I would like to add though, when I was training in America, nuclear medicine is usually done after radiology, and it does not as a branch separately. So can students go abroad for a fellowship, and can they settle abroad? Any insights on that, ma'am?
So yes, fellowships, anyone can go and outside. You can do research fellowship, you can do clinical fellowships also. But of course, every country has its own rules, whether they will allow you to interact with the patient or touch the patient. They have different rules. But the thing is, in India, nuclear medicine is one of those rare fields wherein the kind of work that is being done, it is unparalleled with the Western world. Even in the Western world, the things are not being done which we are doing over here. The gallium DOTA scans, which we have been doing for, I don't know, many, many years now, US FDA gave its approval only, 4 years back. So,
right.
Yeah. So,
I mean, I know the sentinel lymph node biopsies, which we do where the nuclear medicine has to be injected, that was being done by the nuclear medicine team. So there's a lot of therapeutic work also which is happening. And
Yeah.
of the branches, I guess it's a terminal branch. You don't have to, do add on more to this after.
Right.
So it's good
Right.
and the stable growth options.
Yeah.
So,
Though AIMS offers a DM also now in
oh
after
wow,
MD. Yeah,
okay,
AIMS offers DM in therapeutics, therapeutic
right.
nuclear medicine.
So
Yeah.
two questions, ma'am. One, somebody is asking, how do you actually inject the dye? So sometimes, ma'am can elaborate on that about the IV versus the local site injections.
Mm-hmm. Yeah, so it is given IV only. There are two ways. Iodine is given orally. The patient, it is in the form of a capsule or a syrup, a drink, not a syrup. And rest of the medicines, they are injected IV in an IV line. They are injected. We have a syringe shield. So the syringe is inside the lead shield and we
Right.
inject it. That is how it is done.
Yeah. Somebody is also asking whether to do their PG from a place which has a PET MRI versus a PET CT. So I think so PET MRI is a relatively new thing. Very few
Yeah,
centers have PET MRIs. So if there's a PET CT scanner there, that is good enough. You can
yeah,
always
yeah,
upgrade to PET MRI later and learn those skills. Anything which you would like to?
absolutely. No, you're right. So, and even centers that have PET MRI, what they do is they acquire PET CT, they acquire MRI, and they fuse the images. So it's a dedicated PET MR scanner is very rare in India these days, and we really don't know how well will it take up. So as of now, if you get to enter in a setup that has PET CT and gamma camera and therapy, it's more than enough.
Perfect. Now coming to the much debated option of MD versus DNB, what would be your prerequisites when you're choosing an institute for nuclear medicine? What all would you look for if you have to go in for a PG ship or a DNB ship, ma'am?
See, MD versus DNB in nuclear medicine as of now doesn't matter because
Right.
the number of doctors are less. So no one will have a bias against you that you are a DNB and you are not an MD. So that you will never face for a minimum 10 years. I don't see that minimum 10 years because as of now also MD is available only in 4, 5 institutes, not
No,
much.
like
Rest.
the pass rates for DNB, are they good enough? It's relatively
So
high.
again, yeah. So again, one more beauty of this branch is it's such a small field, and if you do really well, if you do your work well, there are you meet all the examiners who come for the examiner. You meet them in the conferences, and if you present yourself well, because when a person fails, the person doesn't fail in theory. The person fails in practicals. So if you have good contacts, you have good connects, and the teacher knows you, and the teacher will know you because again it's a very small fraternity. So if the teacher knows you, there is no problem in passing. I mean, knows you as in knows you, not like that, but then still I'm telling you that passing nuclear medicine DNB is not that difficult. It's just a hype that has been created that passing DNB is really difficult and person
True.
should go for MD. Nothing like that.
I completely agree with ma'am that there's a very little thin line separating MD from DNB, especially in nuclear medicine,
Yes.
because of the very small number of people who graduate every year.
Right.
Corporate government setups, labs don't differentiate between the two. They pay them equally. Opportunities
Right.
are equal, and it's not very difficult to clear DNBs as well.
Right.
Some was asking whether can you do therapeutic interventions after DNB and MD. You can do them either after DNB or after MD as well, doesn't matter.
Right.
Anything.
Right.
Now, some people are asking, what about the MD institutes? So MD institutes, AIMS Delhi has MD nuclear medicine, and
Right.
in NICT exam, the rank went up to 235. At 235 rank, nuclear medicine closed in AIMS Delhi. CMC Vellore through NEET PG, it in 2019 it closed at 1030. So I would say a very high rank at which nuclear medicine was picked up
Mm-hmm.
in
Right.
20. TMH Mumbai again through NEET PG 598 rank. So again a very high rank. AIMS Rishikesh through INICT 477 rank it got picked up, and SGPGI again through NEET PG went at 2450. So I think so students who are inclined towards nuclear medicine are picking it up at a good rank as well. So don't think that the ranks are going to go in 5,000s or 10,000s for nuclear medicine. It is a sought after branch considering how early seats are getting picked up.
Yeah.
DNB institutes, Apollo Hyderabad, Jaslok Hospital, Gangaram Hospital, and Sage GS Medical College in Mumbai. These are the good DNB institutes for
Fortis Gurgaon.
Army also has, RNR also has.
RNR off and on. Sometimes they have, sometimes they close it because it all depends on their Fauji quota. But this Fortis Gurgaon has.
Fortis Gurgaon also has a good
DNB.
And as ma'am mentioned, the things which you should look out for when you're choosing a DNB institute, they should definitely have PET-CT. Please don't choose a place if they don't have a functional PET-CT. The added advantage would, of course, be other imagings like cardiac imagings, TMI-BG scans, and if therapeutic interventions are also being done, that's the cherry on top. Would you, ma'am, would you like to add anything else to that?
So one benefit that one gets from doing DNB from a private institute versus MD from a government setup is that in government setups, the way they do PET-CTs, it's like it's very basic. So though they have top-notch machines, but the diagnostic CT that they do, they usually prefer to do non-contrast CT scans. So the student doesn't get to learn the kind of reporting that the oncologist will expect them to do once they step out into a corporate setup. Am I right, Dr. Rohan? So when you do,
I think so. It's the same with radiotherapy as well. So when you're choosing an institute, make sure that the machines are latest and the techniques are latest, because that is one drawback in radiotherapy also, because some of the old places have cobalt machines in radiotherapy.
Right.
Use any in private.
Right. So that is it.
Do a background check on what kind of equipment and what are the techniques which are being used, because you would want to learn the latest techniques. Otherwise, you'll be at a slight disadvantage.
Right.
Ma'am, somebody is asking, what is the curriculum like when you join the PG? If you could briefly describe what the curriculum for nuclear medicine is over the 3 years.
So in nuclear medicine, we have one book that's on physics, and rest it's all clinical nuclear medicine, the type of imaging that we do, how do we prepare the patient, and how do we do the scan, how do we read the scan. There are a lot of and in nuclear medicine, you have to be very well versed on the data that you have on internet. All like there are seminars of nuclear medicine, clinics in nuclear medicine, and the recent, because nuclear medicine, unlike other branches that have very good work in books, nuclear medicine is all about learning online. It is mostly about learning online and in the hospital setup that you learn from your seniors and the practical work that you do. So there is less of books and more of studying like this, which is good to do. Yeah.
So Madhuri is asking, does the institute determine what kind of a salary you get or whether you get a job easily or not?
No. Only your work matters. That's why I told you that if you go to a government setup, there are chances that you may not be, like suppose you have done your PG from AIMS, but you don't know how to do a contrast PET-CT scan. Now, once you get out of AIMS, you expect that a corporate setup will give me a salary of somewhere between 2, 2.5 or 3. But they won't be able to give you that unless you are able to report a PET-CT as expected by an oncologist. So that happens in private institutes. There they teach you properly. Some government institutes also do. So that check you have to do before joining in.
So ma'am, if you have to list the top 5 institutes for nuclear medicine, what would be your choice considering your vast experience in nuclear medicine?
So in I'm mixing both private and government. PGI Chandigarh is a very good place. Then Dr. Kalur's center in Bangalore, Fortis Gurgaon, and Jaslok Hospital, Mumbai, Hinduja, Tata.
Right.
I think I told 6 then. Yeah.
That's fine. That's okay.
Yeah. So that is it.
So these are the top institutes which ma'am thinks which you should aim for. And of course, we've already highlighted what all you should look out for before you're choosing an institute for nuclear medicine. It hardly makes a difference whether you do MD or DNB. The job opportunities are the same. So thank you very much. ma'am. Thank you for taking out time and enlightening all of us regarding nuclear medicine. Before we sign off, any final words, any words of motivation to those budding nuclear medicine doctors who are planning to take this up as a branch?
So, I mean, I would just like to give my best wishes to all of you. And I'm sure that if you pick up this field, you will never regret. And you'll have plenty of time to spend with your family and to spend the hard earned money that you earn. And you'll love it. It's a nice branch. It's a good branch.
Yeah, I think so. The work-life balance is excellent. I
Yeah.
see you playing cricket every Sunday. So
Yeah.
the work-life balance is excellent. So again, before I sign off, just to summarize, I think so oncology, the number of cases are rising. So all fields which are related to oncology will do well in the next 5 to 10
Right.
years.
Right.
Nuclear medicine has good growth opportunities, a stable branch with good work-life balance, both in the government and the private setup. And very soon you will have a lot of scope in tier 2, tier 3 cities as well.
Right.
If you have any further questions regarding nuclear medicine, I will be posting this video both on YouTube and my Instagram handle. You can just write them in the comment section, and both me and Dr. Charu will be happy to reply to them. So
Yeah,
thank you
sure.
very much again. Thank you, Dr. Charu. Thank you for
Thank
sparing.
you, Dr. Rohan. Thank you. Thank you so
Time.
much. Okay.
Bye.